You can't please everyone and you can't save everything.
That is so true. And I don't remember ever getting kind of that guidance in school. I got it before I went to vet school from my mentors. And I had my mentor try to bring home that reality as well. And I'm going to add on to that. You cannot make everybody happy. Man, this is great advice you're giving. What's the next one?
Thank you. Okay. Number 5 was remember you only live once. We have an amazing, cool career, but also there's so much to experience in life. Take the time off, create memories outside of work.
1000% take your time off. You need to mentally refresh, because the one thing that came up over and over and over in my interviews was a lack of recovery. Today we're doing a follow-up conversation with a young veterinarian. Dr. Ali has had her struggles through life, through school, and now while she's in practice. I am just following up with her to see where she's at, see what she's struggling with still, and seeing what's becoming yesterday's news. Welcome to another episode of Irreplaceable Truths. How is, Ali, I got to ask how everything's been. You've been through a lot this year. The hip, how is it?
My hip is going lovely. I think that's the best thing that's going well. I'm like 14 weeks post-op, and I'm about to be released to run again, which I'm super excited about. What? No, listen, I am going to do a triathlon. I'm doing it on September 26th. That's why I was swimming, because I got to be able to swim. That is definitely my weakest area. But today I did 800 meters continuously, so we're getting there. And for the sprint, it's only 750 meters, so I'm already there. And then I can already bike the distance. And
you got to get up to
what?
1,500 to 2,000.
No, for a sprint, it's just 750 meters.
No, but for the training part.
Yeah, I will, but I've done 1,000.
Yeah, I know a guy who swam in college.
Nice. He needs to teach me that whole. Oh, you swam? You swam in college? No way.
I did.
That's awesome.
What, is that a fat joke?
No. I just didn't expect it.
Yeah, I was a full scholarship swimmer.
Wow, that's cool. No, the whole, like, I didn't realize you're supposed to blow bubbles through your nose while you swim. And then, like, doing the stroke thing. Yeah, I'm trying to figure it out.
Are you coming out to Anaheim for AVMO?
No, I am going to Western in Nashville in August.
Let me know how that one goes.
Okay.
I'm very interested to see how that one goes, because very interesting time of year. Kids are just going back to school. Kids are going to university. Everyone's getting back from family trips, on family trips.
That's true, but the entry fee was nice and cheap, so I was like, sign me up.
Year one. Yeah. So were you there Tuesday for my dissertation?
No, I completely forgot, to be honest.
Oh my gosh.
I know. I put it on my schedule, and then I was running around though, because Tuesday was my surgery day. And then my daughter's daycare like notified me on, like, I think it was Saturday. I got a message, and they're like, "Oh, we're looking for parents to do a career day." Initially, it was supposed to be 10 a.m. or 1 p.m. So I was like, "Oh, I'll do like my dental and my neuter and then my little mass removal before 10." And then my mass removal was way more bloody than what it was supposed to be, so that took me a little bit longer. And then so I was just like running behind. And then I was like, I called my husband. I was like, "Tell them I can come at 1 now." And so it was just chaotic day. But I made it to my daughter's career day, and I brought Aurora, and she just like laid there with all the children, and I was a proud dog mom. She was so well behaved. Although my daughter was like, she was so jealous that I was like talking to other kids, and I was like, "Abby, you got to share me."
Well, I'm really curious, because you're an early career veterinarian. You're a young mom. Do you ever feel guilty that you're not doing enough for your daughter?
Oh yeah. That's why I was stressed whenever I thought I wasn't going to make it to the career day. Like because I ended up delaying to the 1 p.m. And then I was rushing, and of course, I was rushing, and so I broke a root on my cat extraction, which I've gotten much better with dentals.
That was my follow-up question because you were freaking out about tooth extractions.
Yeah, no, I did a dental like 2 weeks ago, and it was a big dog, and I extracted like 10 teeth, and like 9 of them were molars, and it was lovely. But because I was rushing, because I was trying to get to my daughter's career day fair, I just got overwhelmed because I didn't want to miss out on her thing because I wanted to be there for her, and it's just like the guilt of being a career working mom, and then being a young mom too. It's like trying to balance everything.
A young mom on one hip. Well, I mean, I love the social media following you're gathering. I love the engagement you're gathering. Um, I think it's very important for young professionals to hear from a young professional, especially one that's a mom.
Yeah, I will say the most amount of DMs that I get are about how to be a mom and be a veterinarian.
My wife is an amazing veterinarian, and she's an amazing mom. She worked full time, and we had 3 daughters. It's not easy. And she would lay there at night and beating herself up and wondering if she was doing enough as a mom. How do you balance that?
I really, whenever I'm off, I try to spend my days with her. I know I don't have her right now, but it's because they're doing like summer camp. And so she had like a swim day. And, I want her to have her own life too. I want her to have memories with her friends. And, on the day, like yesterday, we went to gymnastics, and then we went and got a bicycle. And it's just like trying to make memories whenever I can.
She loves you, but you're definitely not a swimming pool. I said she loves you, but you're definitely not a swimming day. And you don't compare it to an ice cream party or a princess party. So we used to do that with our daughters as well in the summer. They used to have the best time doing those summer camps, going to the zoo, going to the swimming pool, going to the beach, all those things. So there's nothing wrong with them being a kid.
Exactly. Well, and the one time I did go to one of her little field trips, I went to the swimming day one, and I was like, "Oh, this will be so fun." She was up my butt, and I was like, "Girl, you need to go play. Like, go play with your friends." And she just did not have a good time. I didn't have a good time, so I was like, I will go on another field trip with her, not to the pool."
To the zoo or a museum or something like that.
Yeah. Yeah. We don't have a zoo in our area, which is very unfortunate. Like the closest one is in Salt Lake or Denver. Like they're like 4 hours away.
Wow, really?
Yeah. There might be one in the mountains, but they're not close.
There's one in Colorado Springs.
Yeah, but that's still like 5 hours from us.
Where the hell are you in Colorado?
I'm on Grand Junction, so I'm on the opposite side of the mountain.
Is that east side of the state?
No, so Denver's here, and then Grand Junction's here, and then the mountains are here.
Oh, so you really have to climb if you want to go anywhere.
Yes, yes, which can be, it's nice for me though, as like a veterinarian, because all the specialists are either in Denver or Salt Lake. And so like we get to do a lot, fortunately, and we do collaborate with specialists too. We constantly are like, what should we do for this case? But like it's kind of the benefit of being in our area too, is like we get to do a lot more.
I mean, that's true veterinary medicine. Access to care to specialists is not very common. And those that are in big cities or like suburbia, forget about that. I think, when we were at University of Illinois, people would drive 3, 4 hours to get there.
Oh yeah. I mean, even with my own personal dog, with which we could go into that. Rylan, we ended up finding he had pericardial effusion around his heart. And so I drove him to CSU, to Colorado State, got a full echocardiogram, and that's whenever they found the heart-based mass in the right atrium. And then I was going to like take him home. We were just gonna have a good time, and I was gonna euthanize him and or say goodbye. And he pulled his arm away. So I was like, you know what? I'll give you more time. And then he was doing so well, so I was gonna drive him to a veterinary oncologist. And I was on the way there, and I was going to Salt Lake City, and there's not a lot of veterinarians around there, and his mass ruptured. And I was literally like, it was awful. Like I kind of have PTSD from it because he let out a cry, and then he got ataxic, and I was like, oh my gosh, did you hurt yourself? Like I was trying to be positive, and then he just got worse and worse. And I was talking to the people up there, and they were trying to find me a vet because I didn't have anything with me, which made me feel useless. And I finally got him to a clinic, an hour. I held him for an hour, and he essentially was agonal breathing like the last like 10 minutes. And I was just like, please go. Like, can you, it was just awful.
I remember the first dog that I had that got me into vet school when she passed. Man, that is a gut punch right there. How did you handle that? Are you still grieving with that?
Oh, absolutely. Like I seem okay right now, but like whenever like it happened in Austin's car. So anytime I'm in that car, I just think about him. I can just hear it, you know, and I can see it, and just like it was not good. And it breaks my heart because like I lost my golden in August to hemangiosarcoma, and now I just lost my second dog to cardiac hemangiosarcoma, and it just breaks my heart. And the fact is like I have their daughter, Aurora, that had an accidental litter whenever I was young. They weren't supposed to. Rylan got, you know, he was being a typical male. And so now I'm like, oh my gosh, am I gonna have 3 hemangiosarcoma dogs? And it stresses me out.
And that's what a lot of clients don't understand, is that a lot of this cancer tends to be genetic down the lines. It doesn't matter about vaccines or food or I mean, veterinarians do everything kind of by the book, even though we make the worst pet owners. How have you gotten in any of those conversations with your clients?
Oh yeah. No, actually I had one the other day. She lost 2 labs. So she lost, or maybe it was just one, and she had a new puppy. And so he first presented with a mass after getting a Pro Heart injection, like a few months after it. And then they removed it, and he got his second Pro Heart, and then he got another mass. I don't remember what cancer it was, but for her new puppy, she was like, I don't want to do Pro Heart because she's scared of it. And to me, I'm like, you know, I can work with this. Like, is there science behind that? Probably not. But we also have to support our owners. And if she's worried about that, and I told her, you know, there's not any side effects to Pro Heart, but if you would feel more comfortable, let's just do a tablet.
Simparica tree all day.
Exactly. That's what we were doing. And we don't have a lot of fleas and ticks around here anyway, but I always keep all my dogs on heartworm prevention.
Well, whether you believe in the global warming thing or not, even Phoenix is starting to get a flea problem, and they're in the middle of the desert because humidity. So there's nothing wrong with doing some Trail. I not a big fan of the Pro Heart. I have a hard time give anything that you inject and it lasts 6 months to a year. Do you feel that way?
Well, my thing is it's convenient for one, because I was the worst whenever I was trying to give a tablet. Because at the school, you know, they'd give us our samples, and I'd be like, oh, I'm like 2 months behind, and in Oklahoma, that is a huge heartworm area. And so I'd always panic. I'd be like, oh my gosh, my dogs probably have heartworms. But they never did. So I do like the Pro Heart for that. But also, maybe now that I've had a few dogs that have developed cancer, I'm like, which there's probably no correlation. But it does make me a little bit worried, like having something in there for an extended period of time.
Okay, so if the dog's reacting to Pro Heart, do you have to tell them just to let it ride out, or how do you counteract that?
Yeah, you can't, I guess.
That's my fear.
I haven't had that reaction yet, so
Yeah.
yeah, I better knock on some wood.
I haven't heard of any either, but a lot of people like doing that. It's like a crock pot, right? Set and forget it. That's why the Bravecto every 3 months was so cool, and still until Bravecto stopped working, at least here in Southern California.
Oh, really?
And now they have the 1-year Bravecto tablet, right?
Bravecto Quantrum? It's an injection now.
There's another thing I won't be using.
We've used it. We've used it a few times, and we haven't had any side
Did you use
effects
it in
yet.
epileptics?
No, I don't think I would use it in epileptic.
I mean, that's the fear, right?
Yeah.
And how do you know if a dog's an epileptic until after you give them a flea pill and then they start having seizures?
Yeah, that's true.
Yeah, I mean, all the fun things we go through as a veterinarian that no one really teaches you in vet school. It's unbelievable. And then speaking of vet school, I saw some of your social media posts. You hooded another class.
Yeah, I hooded my vet school buddy. So at Oklahoma State, we're all assigned to the underclassmen. And I was given 2 classmates. And I was like, oh gosh, I'm a mom and now I have 2 of these. But it was really fun. And Sarah, she asked me to hood her. And that was just such a cool experience, being a part of her graduation ceremony and being able to, bring her into the profession. And she also got the Gentle Doctor Award. And so that was really cool to be there for her to receive that. I was just really proud of her.
What's the General Doctor Award?
The Gentle Doctor Award is essentially an award for like everybody, or not everybody, one person from each class gets it. And it's like a person that cares about all animals of all shapes and sizes and is just really compassionate, gentle. It's and your classmates vote on you for it, and your professors as well.
Well, what my dissertation just showed is that Gentle Award is probably setting her up for the hardest part with the reality of practice. Isn't that crazy?
Yeah, maybe. I don't know, but you're right. Because, I mean, you can do everything. You can do every single thing by the book, and everybody responds differently. And you don't always win every single case. And it can be heartbreaking.
What advice have you given them, your little buddies, so far?
Oh, man. I actually wrote her a letter, and I gave her 10 pieces of advice. And hold on, let me pull up my notes so I don't mess this up. Because I'm pretty sure I still have it. Ah, yes, I do. I wrote it on the airplane going to graduation. So my first one was, it's okay to not know everything, and do not be afraid to tell your clients this, because school doesn't really prepare you. I told her to create a good case log, because I think we get so sucked into the cases that don't do well, and you forget about all of your wins.
So so that second one, you were telling her to write down the cases that gave her fulfillment and happiness.
Yes.
Perfect. Okay.
So that was one of my goals I was trying to do this year, was write 3 things that went well with every single shift. To be honest, do I do it? I should do it. I should, because you get caught, like I said, you get caught up in the negatives and you're like, I'm a terrible vet. But the reality is that you have clients that love you and you have wins. And then what else did I write? I told her to follow up on
the saying for that, and I don't mean to interrupt you, but is that 10% of your, even less than that, 5% of your clients are going to make you want to quit your job. You forget about the other 95% that love and trust you. So that's a great piece of advice for her. I can't wait to hear number 3.
Okay. Well, number 3. I feel like that was my strongest one, so don't get your expectations too high. But I told her to follow up on her cases, and I told her to pick up on the little details that your clients say. Because, like, one of my clients told me something about, like, how their dog did something, and I, like, mentioned it at a follow-up, and they were really surprised that I remembered it. And people care about that. It shows that you care about them as a person, not just as a revenue.
Let me ask you a question about that one. Do you record your conversations with your clients?
I do, but do I ever go back and listen to them? No.
Do you ever use a program where it makes a transcript and you can drop it into AI and it'll give you highlights?
So we do use Scribe, and they like make our medical notes, but I don't usually I don't ever go back. I mean, I go back to my medical, like my Scribe, but it just has like my medical stuff.
I would start recording every conversation you have with the client and put it in the chart, because it's all a cover your butt situation.
That's a good idea. I think we backlog them.
You do.
Yeah, they're like in the cloud.
And another thing that helps is, like, you can have this Scribe send an email that is a summary of your conversation.
Now we do need to do that, because there are a lot of times where I just like talk, and I can see my clients get confused. I'm like, I'll send you this, or
Not
whenever
Dr.
you have
Allie, she doesn't talk.
No, never. I never get 15 minutes behind because I'm talking to a room. My texts are like, come on, we gotta go.
Yeah, but you got to realize that extra 15 minutes, or you're 15 minutes behind, is giving that client the feeling inside that, like, she really cares. We're engaging here. She's authentically herself. I'm not just a number.
Yeah. No, that's my theory on it. Is like, I don't want to cut off somebody unless I like absolutely have to, because I want them to feel valued for their time, because they chose to come here, and I care about what they're saying, and I care about how they're feeling about their pet.
Quick question. Rapid fire one.
Okay.
Talk to a client by email or talk to a client on the phone?
I do text. I do like texting because it's convenient, because I can like bounce back and forth. But if it's like I'm following up on lab work, then if it's like an abnormality, then I will call them.
What if you get lab work that's all normal?
Then I text them. I say, hey, Aurora's lab work looks fantastic.
Yeah, when a lot of people don't realize that even clients don't have time to get on the phone and have that conversation.
Yeah.
Because they're driving their Suburban around with 6 kids in the back, and they're going to Costco.
That's true. Trying to figure out their life.
Okay, what's the next one?
Okay, let's see. Oh, number 4. You can't please everyone, and you can't save everything.
That is so true. And I don't remember ever getting kind of that guidance in school. I got it before I went to vet school from my mentors, and I had my mentor try to bring home that reality as well. And I'm going to add on to that. You cannot make everybody happy.
Mm-hmm.
Man, this is great advice you're giving. What's the next one?
Thank you. Okay, number 5 was, remember you only live once. We have an amazing, cool career, but also there's so much to experience in life. Take the time off, create memories outside of work.
1000%. Take your time off. You need to mentally refresh, because the one thing that came up over and over and over in my interviews was a lack of recovery. Man, you're nailing these. What's the next one?
Thank you. Okay. Oh, I said this kind of goes along with 5, but find a hobby. Like we get so caught up in work and, you can go hang out, but I think having something to work for and something that brings you enjoyment is so important.
Okay, so you're married, you have a young child, recovering from hip surgery. What hobby do you have?
I like to read. Do I read as much as what I want to? No. But I have my social media. I definitely think of my social media as a hobby. Like, has it brought me some opportunities? Yes. But at the end of the day, it's a hobby. And I enjoy making videos and content. And then also, I've been getting into like fitness, working out, training for this triathlon. That's a hobby.
The social media is a way of you giving you back. Does that bring you fulfillment?
Yeah, for sure. I really enjoy it, especially whenever I get like messages being like, "Hey, thank you for sharing your story." Like, you make me feel like, I can do this. And that's what really fulfills me. And then also I just like it. I just like putting a video. And like, do I always do everything veterinary? No. Like, should I do everything in my niche? Maybe, but also like I said, it's a hobby. So I just I make what I want to make.
Are there times you come home from work because you're training for a triathlon and you're just like, no way?
Oh yeah. Oh yeah. The past two
How do
days
you
I
push
haven't
through
done
that?
squat.
How do you, yeah, but how do you push through that?
How do I push through it? I'm like, I have this goal. I got to show up. And then also typically for my I work 12s. So I bring my gym clothes with me and then I go to the gym right after work. So I don't give myself the opportunity to come home and just go to bed.
So you're very disciplined about how you do it because you know where your mindset's at.
Yes. Exactly.
So if you have a tough day and you're driving home and you go to the gym, does that help you?
Oh, absolutely. It helps like clear your mind and then also gives me another sense of accomplishment. Like I went to my job, I worked hard, and now I'm also taking care of my body and taking care of my health.
Do you tell anyone at the gym you're a veterinarian?
No, I have my headphones in. I don't talk to people. I mean, I'm very social, but I also, I gotta, especially after working a 12-hour where you're just talking to people all day. I'm like, I gotta have a break.
Do you consider yourself an extrovert or an introvert?
Oh, definitely an extrovert.
So it's not as exhausting talking to clients as it is an introvert.
No, and I enjoy talking to the clients too, and I enjoy seeing like what they're up to. I think it's fun, but does it wear me out a little bit?
Yeah, it the case word the case load continuously never stops. Your brain has to be going. You got to think about the person in the room. You got to think about the animal that's hospitalized and the animal that's under anesthesia all at the same time.
Yeah, absolutely.
And wondering what your family's doing, what your daughter's doing. Uh,
Yeah, no, Austin, I was working a Saturday, and this was the busiest Saturday that I've ever had. I ended up seeing like 20 patients by the time it was like 3 p.m., which is a lot for me. And I was like overwhelmed. And then I finally had a break, and him and Av took the dogs and they went up to the mesa. And, he sent me a video of them just hanging out at the lake and then also like barbecuing. And I'm like, oh, I wish I could be there. And instead, I'm stuck inside at work, pulling foxtails out of dogs.
oh, the infamous Foxtail.
Dude, they're so bad. I pulled one out from under a tongue yesterday. No, not yesterday. Tuesday.
The worst Foxtail case I ever had. I had a Rottweiler that was acutely down in the back legs, and it went in for an MRI. And when they put the dye in, they saw the track the Foxtail took through the nose, down the trachea, through the lungs, through the diaphragm, up into the spinal cord.
They're awful.
Awful.
I believe it though because I had one. My colleague saw her first, and it was like in the foot. They couldn't find it. I saw it the week after, and like her draining tract was all the way up to her carpus, and I still couldn't find it. And then she came back a third time, and we finally found it. Thank God. Because I told her the second time, I was like, I think you should go get a CT because I don't want this just to keep on migrating.
It's so fun talking to Dr. Allie a year later. Oh my goodness, look at her.
I know.
Do you have mobile CT out where you are in the middle of nowhere?
No, you have to go. You have to go to Denver or Salt Lake.
Yeah, that's the problem with those CTs. I mean, we're lucky here in Orange County. We have mobile CT, but do you always tell the owner you're going to go in there and find that foxtail?
Oh no. Last
Okay.
summer, whenever I was starting, I had the worst luck finding the foxtails. I don't even know what my statistic was, but it was really bad. And my techs will also look too. Like we've trained our technicians to look for the foxtails, but I kind of enjoy finding them. They're really fun to just pull out. And then this year they're really big, so I've been a lot more successful. What? No, I pulled 5 out of a dog's mouth. Like,
If you find one, you got to go look for the brother, the sister, the cousin, and the uncle at the same time.
yeah.
You're lucky if it's just one. But foxtails are awful, awful, awful.
Yeah, I never heard about them until coming to this side. Like back home, I don't remember ever pulling a foxtail, or we called them like grass seeds or grass-ons back home.
But they're a little different. The grass-ons are a little different than a foxtail.
Yeah.
That foxtail is so dry, and it goes in, and then it becomes like a molly bolt, right? So it spreads its wings, so it can't back out.
But they're fun if you can find them. Have you found one on ultrasound?
I have.
Yeah, that's cool. Whenever you see it on ultrasound and then you go with the alligator forceps and pull them out.
So another cool case, foxtail wise, I had a dog that was an 8-year-old spayed Ridgeback, purulent exudate, looked like a pio. And I'm like, oh no. I go, this dog hasn't been in the heat in 5 years. So ultrasound came in, and it was the whole chain of them.
A chain of them.
Yeah, like the whole, like if you look at a foxtail,
Yeah.
you can have the individual ones that break off,
Mm-hmm.
but they're all in a stem.
Yeah. Yeah, I've seen the plants out on the road.
Yeah, so the stem was all the way in there.
Oh my gosh.
And there was so much discharge, there's no way in heck you could see it when you scoped up there. But my ultrasonographer was able to find it. So we went in, flushed the heck out of it, pulled it out, cultured. It was weird too. It was like I think it was actinomyces or something that deals with plant bacteria.
I think it is actinomyces for the cows in the mouth. And so it makes sense for the plants too.
Yeah. So anyways, that's the foxtail talk. What was your next one?
Oh, let's see. 7 was just because you're the youngest in the room does not mean that you can't teach your colleagues. You have value. Do not be afraid to try new methods.
That brings up the whole concept of fear versus confidence. Where do you think you are on that scale right now?
Depends on the topic. Depends on the case. Sometimes I'm like, oh, this, I got it. But then, I had a case it started with the eye. And the dog was initially just a little bit discharged. I tried to stain it. He was so just like bouncy. I offered sedation. The owners declined. I thought I saw some stain uptake. So I sent it home with like some triple antibiotic cream, some carprofen, treated it as an ulcer. Then it came back. We sedated it, did a full ophthalmic exam, and there was really no abnormality. So then we did a consultation with an ophthalmologist, and she was thinking it was immune mediated. Well, then it comes back a week later, and the dog is super lethargic, not eating, pacing, like very restless. And so then I did abdominal ultrasound, or actually no, we took rats because we hadn't done any imaging. We were sent off lab work. The only thing on labs was the C-reactive protein was just really, really high. And so we were on a cancer hunt, and we found a mass in the abdomen on the spleen. So I did a splenectomy, The dog did well for a few days, and then it ended up passing. And, it's like, once again, it's like I was confident throughout all this, not really super confident, but confident, especially whenever we found the mass. I was like, this is the problem. And then it wasn't. Who knows what the problem was? I'll never know.
Yeah, exactly. You never know. Did you get, what was the splenic biopsy?
We're still waiting on it. But it was about a baseball size, and the omentum was starting to fuse to it, so it probably was leaking.
So it ruptured in the past.
It had to have done something at some point with omentum, but on the basic labs there wasn't anemia, which was interesting. But with those splenic masses, they can seep and.
So the ophthalmologist thought it was an autoimmune problem like Panis or something like that?
It wasn't Panis. She was thinking it was something I'd never really heard of. I couldn't even tell you.
So it was a perineoplastic syndrome.
Maybe, yeah, most likely. I think it was with the eye. We were treating it
with
like
Doxy. The eyes are the gateway to this whole.
Yeah, but it's just weird.
Was the eye squinting, or is it just not looking right?
It just wasn't looking right.
Hyphema?
No, there was no hyphema. It essentially was like on the cornea. There was like a spot, like a circular spot, and it was a little bit like darker than the rest of the eye. But there wasn't a lot of like conjunctival hyperemia. There wasn't any blepharitis. Like it was just a little bit abnormal looking.
So corneal melanosis.
She didn't think it was melanosis.
Oh, she didn't.
No, she thought it was immune mediated.
All those weird things on the cornea, I automatically just refer.
Yeah.
Because corneal degeneration, corneal lipemia, corneal dystrophy, nightmare.
Honestly, the eye's just a nightmare. I mean, how often do you're like, oh, it's just a simple ulcer, and then you have it on the triple antibiotic, and then you come back and you're like, oh, it's still there. So you have to add something else to it.
Trick. If you have a corneal ulcer, pull the animal's blood. So if you have a dog, pull like 12 mLs, put it in a serum separator, spin them down, and use that serum.
You don't use the horse serum?
No, use the animal serum, so you don't have to worry about any reaction to it's someone else's serum.
Okay. I'll try that.
Little trick. So you put a drop of that serum in. It has more enzymes than the tears to help clean it up. And then you put antibiotic drop in about 5 minutes later. Keep the serum refrigerated. It's good for about 5 days. So that's just another one.
See?
What was your next one?
Oh, I gotta pull it up. I shut it down. I said stand up for yourself.
That's the whole psychological safety issue that management loves to talk about right now. And I think it's very important you stand up for yourself. And if you're in a practice that you don't feel as if you can, then you're in the wrong practice. Did you ever have a problem with that?
No, my practice is great, but I did have a situation where I had homeless people come in to the practice. Their dog had an abscess or something, and technically we are like a pay it service, and my techs were like, yeah, I don't think they can pay, and they were almost gone, and then I was like, you know what, I'm just gonna go look at it. So I went to go look at it, and we have donated medications that people bring back that we can give to clients if they need some help. And I came back out, I went to go find what I needed. And then my medical manager was like, well, why'd you do that? Like, why they were about to leave. And I said, because I wanted to. Like, we have these medications for a reason. And like, my whole thing is I'm here to help people. Like, yes, I'm here to also make money to live my life, but doing the occasional good deed is totally fine. And later he was like, you were right. Like that is a case that you can do that.
Does the access to care piece ever play on your psyche?
Oh yeah. Oh yeah. Like I had a dog that had a broken femur, and they couldn't afford the surgery. And I hate that. Like I wanted to be able to help, but unfortunately like we couldn't.
My favorite professor from Illinois, Dr. Sheila McCullough, is now the president of a nonprofit that helps veterinary clinics set up angel funds. Do you believe clients would be willing to round up
Yeah,
their bill?
I think so. I mean, half the time I round up my bill whenever you go to like Walmart and they're like, "Would you like to round up to help whatever?" I'm like, "Yeah."
I always feel that if I don't do that, karma will bite me in the ass at some point. It's a psychological thing, I guess, for me. But it would that be something your clients would be interested in doing?
I feel like there would be a lot. And we do have an angel fund, but I guess our team is slacking on asking for services. And I think we were negative because we used too much of it.
Do you guys do any fundraising events in the community?
I don't think we have since I've been here, but it's definitely something that I'm interested in.
Would you what would you like to do to be active in the community? Because it's very important as a veterinarian you are active in the community.
Yeah. So one of the things that I'm actually working on right now is, especially after losing my two own personal dogs to hemangiosarcoma, is I actually have been talking to the Morris Animal Foundation, and I'm planning on setting up a fund to raise money for hemangiosarcoma research. And so my project's going to be called um, the More Time Project. And so that's gonna be my way to give back. But I have never really thought about working like with my own clinic to raise money for people. And like I talked about that, like if my social media stuff ever goes off, and I started making revenue, like I would love to make an angel fund where I can use these funds to help my clients. But we haven't got there yet.
Are you going to set up a nonprofit
Maybe. Oh, for which one?
for your hemangiosarcoma?
Yeah, so I'm not going to set up a nonprofit. I thought about it, but I think since the Morris Foundation is already established, creating just a project within them is would totally satisfy my needs for feeling like I need to give back. But I'm working right now, like I said, like I'm working on setting up like the page for it, and then I'm working on like gathering some stories about dogs that have had hemangiosarcoma, because I didn't realize, like I knew it affected a lot of pets, but it affects 300,000 dogs every single year. That's a huge number.
It would be interesting to get those stats. Like, what breed do they have in there? Is it your lab German Shepherd Golden?
for for the numbers.
Hemangiosarcoma.
Oh, I think it's just like any. I don't know if they're truly like d- they're truly diagnosing it based on like histopathology, because I know some people will be like, oh, my dog had a hemoabdomen, but was it truly hemangiosarcoma? Was it something else? I mean, most likely it was hemangio, but I'd have to look into that.
Yeah, well, there's a lot of things that grow in a spleen, you know. And when I tell clients when I go in, it's a coin flip. It's either going to be benign or it's not, and you got to go from there. But if it has a hemoabdomen, you got 30 seconds to make that decision. How do you have that conversation with clients? Have you learned that art form yet?
For what? The whole like 50-50
Yeah.
thing? Yeah. So I had one that I was convinced was hemangio, and it ended up being like a hematoma. And I was like, oh, this is fantastic. Like, this is much better. But my last one that I removed the spleen, I told her, like, it's a 50-50. Like, sometimes they can be benign.
So what's your next one? We're at number.
Okay. Oh, 9. You can't give everything away for free, but sometimes you can. Sometimes you can sneak it in there.
So your manager that works there, if she heard you say that, would she be pissed?
Probably. He'd probably not be very happy with me. But also, he is also the worst about helping people in the community. Or like he helps his clients all the time. And he always tells me, he's like, I'm trying to make you better than me.
How do you get over as an early career vet realizing that it's not your job to manage your client's checkbook?
Man, that is really hard. And one of the things that really helped me was whenever I got my own medical bill back for my own hip surgery. I was like, holy cow, my hip brace was $1,700. Like that's just crazy. And the fact is like we you offer everything that you can. You present the best plan. And then it's up to them to decide, and it's up to you to tweak it as you can. Because at the end of the day, like we have to be able to pay our technicians, we have to be able to pay our support staff, we have to be able to pay to keep our doors open.
Well, I really think it's become a luxury item knowing a pet, which is sad.
Yeah. Yes, I hate the saying, if you can't afford a pet, you should not have one. I think that is the worst thing to say because we don't know people's life circumstances. What if they were financially responsible then, but what if they lost their spouse and so they lost a source of revenue or they had like their house? There's just so many factors that go on in people's lives.
Do you push pet insurance?
I have now been starting to talk more about it, especially with going through my own pet stuff. I really wish I would have had pet insurance.
It's not cheap, even if you are a veterinarian.
No, it's not. Especially if you need like specialty services. Like I was gonna go take Rye to go do that CT, and to do the CT, I think it started at like 2,500, and then to do his radiation for his heart, it was gonna be about 5K. So I was gonna drop 7,500, and I have student loans. So was that the most financially responsible thing right now? Probably not. But he was my buddy. I grew up with him. Not I had him since I was 21. Like he'd been through so many life memories with me, so I wanted to have more time.
What was the discussion they had about pet insurance during vet school with you?
We honestly didn't talk about it. I don't remember talking about it at all.
Do you think that's a big gap?
Oh yeah. Talk we should just talk more about finances in general. We should talk about pet insurance. We should talk about the clients that can't pay for the gold standard because that's the reality of medicine.
Pet insurance is huge. So my little tidbit is that anytime you have a puppy or kitten come in, one of the handouts they get is the different pet insurance options. I'm not saying choose one company. I'm saying just give them all of them that are out there.
Do you have a favorite one?
You know, they all have their pros and cons. Um, I just make sure people do not get pet insurance for wellness. I tell my clients that pet insurance is like life insurance. You do not want to use it because that usually means a traumatic thing happened. You use your pet insurance if they eat a tennis ball, get hit by a car, get beat up by another dog, stuff like that. You use your life insurance if you're dead. So that's how I bring it to their attention. I tell them at least out here one night in a specialty clinic is $5,000. That's just the hospitalization. Heaven forbid they need to get surgery, diagnostics, imaging, multiple referrals. But if you get it when they're young, puppy or kitten, everything's covered.
Or like up to like 90%, I think is a lot of them.
But there's no exclusions. But they have to look as well what company they're going with because some people, for example, the Cavalier King Charles, there's some insurances that will not cover heart disease. It's just out there. The newest thing they're doing is how they're paying. They are direct depositing the cash right into their account if you take a picture of the invoice of the estimate.
Oh, that's nice.
The OG way was you paid it, and then you fought with the insurance company for like 3 months, then you get a check. But by then racking up all this interest on your credit card. So those are things to just look at. But I do wish vet school would go over more of about the financial part, like prepare veterinarians for the realities of practice. And I wish you were there Tuesday. I wish you were at the AVMA. You'll hear that speech again.
I thought about going to it because it was like, is it this weekend?
AVMA, no. PackVets this weekend. I'm speaking there. I have 3 talks. I'm talking on itching. I'm talking about diarrhea. And my third talk is they never taught us this in vet school. You've been out long enough.
You can give me a little sneak peek.
Yeah, well, they never taught me this in vet school. Every single anal gland issue you possibly can think of. Ear hematomas, hygromas, foxtails. What other ones could show? Oh, broken nail. What other ones have you seen that you're like, we see this a lot and they never talked about it?
Ear infections. I think that was my number one. I was like, I don't even know how to
Well,
treat an ear infection. Like, there's all these medications, but which one's best? I just knew don't use gentamicin if the eardrum's not intact.
I'd never used gentamicin at all.
Yeah. Well, also, how often can you? I mean, sometimes you can get a really good look, but sometimes they're just so painful you can't even look in the eardrum.
Oh, yeah, it's so painful, infected, and nasty.
That's in my itching talk because I'm going over the difference just because those 3 are in the early career veterinary track. So Dr. Danny Rabler and her Ready Vet Go put together this whole track that's just geared towards early career vets.
Yes, I was supposed to fill out a form for that, and I forgot. I think today's the deadline.
Okay, so what other things did you not learn about in vet school, but you see a lot of?
I mean, honestly, everything. I mean, gosh.
Other than derm, diarrhea, and dental.
Yeah. I do think the toenail was one that I was like, what do I do with this? But obviously, you just cut it back. It's not that hard.
Or if it's just a small fracture, you just bandage it and let it grow up.
Yeah, or just what else? Yeah, we didn't really talk a lot about
another one.
What?
Pad problems when they're walking on hot asphalt or been walking too far.
Yeah.
Basically, those pads heal up in about 4 days. It doesn't take long. So there's another one. Thank you.
Hey, I didn't even say that. You came up with it on your own.
What's number 10?
I didn't even write it down. I probably told her just have fun. Have fun. Enjoy your career. That sounds like me.
Are you having fun?
Yeah, for the most part. I mean, I'm kind of in a slump right now with that one case I was talking about, with my own dog passing. Like, it definitely just comes and goes.
So how does Dr. Alley deal with that?
How do I deal with it? I think having a life outside of your job is super important. And then also realizing that you're doing the best with the knowledge that you have.
Yeah, you got to give yourself some grace. And it's very hard for someone who is nurturing and a perfectionist to give themselves grace. On a scale 1 to 5, how good are you at doing that? 1 being not at all, and 5 being I'm amazing.
I think I'd give myself a 3. I would say if what?
Way to take it, Stan.
Hey, because yes, I will get like bogged down. I was feeling really bad the other day, but then I realized that I'm not perfect. Medicine is not perfect. You do the best that you can, and then you got to move on. You have other patients to take care of. You have other opportunities to do better.
Have you met anyone who's perfected medicine yet?
No, because all of us make mistakes.
That's why we call it practicing veterinary medicine. Since we last talked, what do you feel confident in yourself compared to a year ago?
What do I feel confident in? Surgery. I've gotten a lot better with surgery. Like, I can do a splenectomy. I got that. And then also
Splenectomy.
Harder or easier than a spay?
It's easier.
Okay, good. Cystotomies, have you done them?
I have not done a cystotomy yet, and I'm so upset. I really want to do one. We did have a situation where our UCath, the cat chewed it off, and so it went into the bladder. I did help with that, but I've not done a cystotomy where I pulled stones out.
Have you seen a cystotomy yet?
Yeah, I've seen one.
Did it seem harder or easier than a spay?
I think it seemed easier. It's pretty straightforward.
How many spay nightmares have you had in the last year?
I have been very fortunate. I have not had one. Actually, my worst ones were whenever I was in school, which I'm like, thank God. Thank God it happened whenever I was in school. They were both on like postpartum cats, actually. And the first one, I ripped the uterine horn while I was following it. And so it was just like bleeding everywhere. And then the other one it was before I knew how to auto-ligate. And I was ligating and I did my ligatures too tight. And so I cut through everything. And so I had to have one of my professors scrub in and help me with that.
When an early career vet comes out and they're doing a spay, when they're doing another spay, what would you say to them if they're like, I really need to make a small incision?
I would say make it as big as you need to. It heals the same regardless. It's all better to have better visualization.
Side to side, not end to end.
Yes, exactly. Yeah, because I get in that headspace too. I'm like, I want to make it so small, but on those big dogs, I'm like, you know what? I don't really care. It's better to make.
Have you done the 150-pound lab that should only weigh 90 pounds?
I have not done that. My biggest one so far was a oh my gosh, what are those called? The ones that wear the barrels. I'm blanking on it. A Saint Bernard. I did a Saint Bernard spay when she was like 110. She was 4 years old. And so that one, I took my time. She was very fatty, very bloody, but I just took my time. I was not worrying about time. And that's the thing too, is like, I used to be like, oh, I want to be the fastest. And I'm like, I would much rather be proficient and make sure my ligatures are good than trying to have the world's fastest spay time.
Yeah, anytime you rush anything, whether it's tooth extraction, spay, talking to a client, it will come back and bite you. So that's great. Are you doing any mentoring at all?
Am I doing any what?
Mentoring?
Am I mentoring? No, I'm not mentoring yet. No, I'm the youngest in my practice. We did have a vet student come in, and I kind of was like walking her through like my splenectomy, showing her things, and that's fun.
Did you? So you enjoyed mentoring?
Oh yeah, I love teaching. I plan on, once I get finished with being like doing not my mentor. Once I get finished with like clinical medicine, I plan on going back to and teaching. What
graduate degree are you going to get?
I don't know.
Do you think that's a problem that GPs just can't go back and teach?
They can. We had GPs at our school at Oklahoma State.
All the time?
Not all the time.
In the classroom?
There were some, yeah. But I guess most of them they were working.
Were they guest speakers or full-time speakers?
Dr. Raymond, I don't think she had a PhD. I think she was just a regular GP. And then she also had a special interest in rehab. That's kind of been her thing, is she's starting to get into rehab.
Well, that was something you're still very interested in, right?
Yes, I am.
Was she boarded rehab?
No, she wasn't boarded.
Well, kudos to Oklahoma State, because that's very unheard of. And my argument is that what I call the gatekeepers, that's who accepts people into the profession really have no idea what the profession's all about in the front lines. And they're the same people that are teaching the students as well. And I'm not saying they're not brilliant, but I'm saying they're lucky. Would you agree with that statement?
I think, yeah, I think if you just go straight from like veterinary school, going into your specialty, I do feel like you probably are missing out on a huge part of like what it is to be a practitioner.
Did the professors ever tell you not every client's going to get an ultrasound and this is what you should do?
Say that one more time.
Did your professors say not everyone's going to pay for blood work? Not everyone's going to pay for x-ray. Not everyone's going to pay for ultrasound. This is what you should do.
I think yeah, like I told you, we didn't really talk about that, about them not paying for services.
So what have you learned to do?
I've learned to offer what's best and then adapt to the plan. So like if a dog that comes in for possibly eating something they don't want to do radiographs, then I treat supportively. And I'm like, if they're still vomiting, you need to come back. And we need to do radiographs then.
And do you mark that in the chart?
Oh, absolutely. It's all documented with that scribe because I don't want to get sued.
How often did they tell you in vet school that you were going to get sued?
Constantly. It's been my greatest fear in of my career so far. So I'm like, oh gosh, I messed up. They're going to come after my license. And so far, I've been good.
If you have a case that's not going the way it should, or it didn't turn out the way it should, do you feel by communicating, being empathetic, and authentically yourself with the client that helps?
Yeah, absolutely. Because like we talked about, medicine's not perfect. Everybody responds to things differently. And if it's not working out with me, then let's get you somewhere where somebody can help you better than I can.
Can I ask how many times that happened?
I have one right now where I reached out to a specialist. He told me to don't like I was gonna send it to a specialist to have surgery. It was like a tibial crest chip fracture from a Frenchie. And he told me it didn't need surgery, just bandage it. And so we were doing that. But then he kept on getting out of the bandage. And we retook radiographs on Tuesday, actually. And there was a lot of remodeling in the joint. And so I said, you know what? We're going to reach out to Colorado State University and let's see what their recommendation is.
And what did Colorado State say?
I'm waiting for the response.
And what did the client say?
The client was really understanding. Yeah, because I did reach out to a specialist right then and there whenever he initially presented. And then I was like, it's not working exactly how I want it to, so let's figure out another plan.
Are you learning clients are very receptive to the fact you go that small extra step, which is reaching out to the specialist?
I think they appreciate it. As I've gone through this year more and more, I've reached out to more and more specialists because the fact is that we have to know so much and they learn so much about one area. Like I would much rather them go to them or them tell me what to do because they're the experts in the field. I'm like, we have these collaborations for a reason.
Specialists are there for a reason. And most specialists I know will get on the phone and go over a case. Now, you can't use the specialist on the phone over and over again and not send them any case because then they'll probably not get on the phone with you. But if you start building a rapport with a specialist, they're usually pretty good. Who do you use for your specialty if you're in the middle of nowhere?
So we have, because I'm with a corporation, so we have like a portal and it has like oncology, dermatology, behavior. There's pretty much everything, internal medicine. And so you can submit a consultation. You can make it like ASAP. You can make it like, just like standard time, and they'll get back to you. Also, I have the internal medicine specialist number. So I will sometimes call her and be like, hey, I need help. And then, and then, yeah, so we have those. And then obviously we have Colorado State too. We have Antec, which Antec specialists are not as nice. I will say that. They're a little bit more. And then Zoetis also has specialty services. So there's a lot out there. I didn't realize. I thought going into general practice, I was going to be like on my own and I was just going to have me and my little clinic. And the reality is that no, there's a whole world out there. And if you want to get help, you can absolutely get help.
For those practices that are out in the middle of nowhere as well, there is a specialty telemedicine that's based out of Charleston, and they have cardiologists, internists, all those things, and you can they'll get on while you're doing an ultrasound, or you send the ultrasound images to them and they'll give you the information.
That's nice.
It's all about access to care, because we're all in this for the same reason. The fact that you have to learn the art form of dealing with the clients is its own thing as well. I think vet school does an excellent job preparing us for the technical. It's just the client communication, the whole concept of pet insurance. I mean, those are just examples that you got to learn as the year goes on. What's the number one lesson you've learned in the last year?
I would say if you don't know, find someone who does.
Do you believe your I don't know cases are getting less and less?
No, I think they're getting more, to be honest, because as I have become more efficient, I'm seeing more cases on the regular, and you get more complicated medicine cases.
Do you believe it's your fear is leaving?
No, I mean, I would say I am more confident with being able to say, let's get you, like, I'm not sure, like, let's find somebody who does. I guess it's been the biggest takeaway from this whole thing is I realized, man, I really don't know everything.
But I don't remember talking to you a year ago, and as we've talked, obviously offline, you ever coming across as someone who thought they knew everything?
No, I'm not typically very no. I know that was not a very coherent statement.
You really put yourself out there. Let me tell you.
It's fine. I am from the South.
You are from the South.
I am.
But your story, of course, is amazing. And if the listeners want to listen to it, go back a few. You'll find Allie Williams in there. But now she's becoming truly Dr. Allie Williams. And it's been amazing to hear your journey and how you're changing and how you're not scared of tooth extraction.
I know, thank God. I know, I actually, whenever I did that dental on that dog where I pulled 11 teeth and like most of them were molars, I was like, Dr. G would be proud of me right now. I didn't cry. I was so proud of that.
You cried all still?
Yeah, I literally cried on Tuesday whenever I was trying to get that cat tooth out and trying to get to my daughter's thing. Yeah, it's definitely just ups and downs. I joke with one of my colleagues. I was like, I don't think I've ever cried in front of somebody more than you, besides my husband, because it's just like, it's just part of our job. Like our jobs are hard, and then also just with the fact that I've had 2 cancer dogs now, I'm very unfortunate, very unlucky, I guess.
As I tell my kids, or I dealt with young professionals, not veterinarians, but as clients, adulting sucks. It's not everything it's made out to be. And I'm wondering if that's why I went back to school.
Yes, I do. We're always so looking forward to getting out of school. And then you get out of school and you're like, wow, now I have to go to work every single day. And I love my job. I genuinely do. But also, whenever I was in school, I could just study. And then I made my own schedule. I did whatever the heck I wanted to.
Well, you are definitely someone that people need to get a hold of. What are the best ways to get a hold of you?
So I'm on Instagram and TikTok at Dr. Allie Williams. You can follow me there. Instagram definitely loves me a little bit more than TikTok, and that's totally cool. Also, if you want to, you can email me at dralliewilliams@gmail.com. It might be a little bit slower to respond, but I'm happy to help.
Well, I wish you the best of luck at preparing for this triathlon. Kudos to you coming off of hip surgery to do that. But swimming is the best rehab, just so you know. And have fun in Nashville. And not good luck. Slow down when you're doing the spay, when you're doing those tooth extractions. And make sure you get a hold of them after your first cystotomy.
Okay, I can do that.
To all the listeners out there, thank you so much for listening. I love doing these follow-ups because I love to watch the whole career blossom. And just to remember, you don't know everything. You're not expected to know everything. And it's okay to say, I don't know. We'll catch you next time on here on Irreplaceable Truths.